This is Group 16 Wiki Project, and I'm Medad.
Alexa.
Lami.
Sarah.
And we're talking about Roxolid implant and the benefits and downsides of it. Hope you're going to enjoy this video. What are the important features of Roxolid compared to the normal titanium grade 4? It's in a nutshell, basically has a less diameter, has a smaller diameter, which ultimately is going to allow you to have a less invasive procedure when it comes to the implant surgery. It's going to be less drilling, it's going to be easier placement, less discomfort for the patient, shorter procedure, and a shorter healing time. And that less invasive Roxolid, it's something that makes it head and shoulders above and better than a titanium, especially given that how patients could be, fearful of going through a surgery. Showing that it's less invasive than a normal titanium implant is going to make the patient feel better. So not only has it's less invasive, it has more strength, both when it comes to the tensile and also fatigue strength. We see that on the graph on the left, and by the way, these graphs have been taken from the Roxolid Straumann website themselves. On the left, we see the higher tensile strength, which is much bigger and much better compared to the normal titanium grade 4. And on the right side, we see the fatigue strength, which is again much better than the normal titanium grade 4 strength when it comes to the fatigue strength. And there is a 0.04 fracture, 0.04% fracture rate, which again, it underlines how great of a alloy we're talking about. And the reason is it incorporates 15% zirconium. Now, 15% zirconium is not something that has been seen in a normal titanium grade 4, and that's when the magic happens with this Roxolid implants. Now, given that we all have those benefits of having a better strength and less invasive procedure, it comes really at no cost when it comes to crest bone level change, which is a study that they have done. They have compared the Roxolid compared to the normal titanium grade 4, and they found absolutely no significant difference between these two compounds when it comes to the crest bone level change after 5 years, which shows that we have all those clinical benefits without downsides. So the question comes, who are the major applicants, or what are the major uses for this compound? And elderly patients are the ones who are going to benefit the most out of this Roxolid Straumann implants. Why? Because it is less invasive, and when it comes to elderly patients, they might have less available bone that the dentist can work on, and having a great osteogenic compatibility is going to resolve that issue. So the patients who otherwise with titanium, they could not get the implant surgery, they're going to be able to get that implant surgery with the Roxolid. And it also, at the end of the day, has a lower cost, which kind of like makes it the perfect package for patients to get these implant treatments.
So improved outcomes due to the improved features of Roxolid. Roxolid is made out of alloy as opposed to the traditional implants, which are made out of titanium, and that provides more strength and reduces the probability of the implant fracturing later on. It also provides less patient anxiety because the procedures are shorter and they are less invasive. Patients feel more at ease when choosing Roxolid as their implant option. And it also has faster healing times. This is due to the hydrophilic surfaces of the implant that provides a shorter healing time for the patient, which is a very a favorable outcome for most patients. And it also has reduced treatment costs. When using Roxolid, the likeliness of the patient needing a bone graft is significantly reduced, and that automatically costs for the patient. And lastly, Straumann provides reduced treatment costs if the implant fractures later on. So that is favorable for the patient and the doctor when looking for treatment options later on the line if the implant fractures.
All right, next we will be comparing the ZimVie T3 Pro Tampered Dental implant to the Straumann Roxolid implant. Comparing the two, we can see that the strength of the Straumann implant is 850 newtons versus the strength of the ZimVie T3, which is only 750 newtons. This strength difference is due to the fact that Straumann has titanium and zirconia, like my colleagues have been saying this presentation, and the ZimVie only contains titanium. The addition of zirconia really improves the strength of the implant and improves the duration that the implant will be in the patient's mouth. They both have similar healing times. The Straumann claims to heal in about 3 to 4 weeks, and the ZimVie claims to heal in 1 month. The Straumann has a little bit better osteo integration, but not by much. The ZimVie improves ossification by having a coarse, fine, nano rough surface, while the Straumann company has developed a special SLA active coat that is a large grit blasted and acid etched to increase hydrophilicity, which causes a better integration, again, meaning the patient will have a better reaction to the implant being placed. And both have a similar ease of use, and both function to maintain biocompatibility while still retaining the best mechanical properties that each company can.
All right. So we spoke a lot about this Straumann Roxolid implant, but what's really important is when placing this implant that proper guidelines are being followed. So with this implant, we want to make sure that we have proper procedure planning. This will help minimize failure, allow the survival rate of the implant to be maintained at the high 98% level that they do have, and will allow for proper restoration. So with planning, you really want to make sure that there is 2D or 3D imaging done. This allows the doctor to be able to see the patient's anatomy, their bone density, and other information of what's going on to the mouth. Also, wax ups can be beneficial to help mark up the patient's anatomy and help with planning. So with this whole planning allows the doctor to decide what implant diameter should be used, and also which implant type, whether it's SLA active or SLA of the Straumann Roxolid collection. Also, with the planning, you can see via the 3D imaging the positioning that the implant can be taken. So we have guidelines of 1.5 millimeters from adjacent teeth when placing the implant, and 3 millimeters from adjacent implants. This allows for the restoration to be properly placed on. There's proper spacing that allows the patient to take care of the implant properly and maintain that oral home care and decrease any issues in the future. Another important guideline is for the palatal facial bones to be 1 millimeter thick. This will help with the stability of the implant. Of course, if the patient does not have this based on their imaging, bone augmentation can be used. And after the healing process with that procedure, then the implants can be still placed. So there are factors to follow, would be during the surgical procedure, guided surgery could be used. This allows for predictable results. So how it works is you send off a scan to the lab, and the lab will be able to create a surgical guide that allows the doctor to know exactly where the implant should be placed. Successive widenings used during the surgery that allows for good bone integration, and osteotomes could also be used for bone condensation or lifting the sinus that allows for proper vertical integration of the implant. Post-op healing is something the doctor also has taken into consideration, as Straumann allows for a closure cap or a healing cap or abutment to be used. The closure cap would be submucosal. This is used for more aesthetic regions or regions that use guided bone regeneration or guided tissue regeneration. This allows it to properly heal. However, this does include another surgical uncovering step. With the transmucosal healing abutments, it allows for the tissue to heal over that abutment, and creating that space for the actual restoration to be placed, whether it's a crown, bridge, or a denture and depending on the patient's situation. Another thing to take in mind is that healing really does depend on the patient. So that's where the planning really is important. So the doctor knows the patient's situation, their bone type, and which implant is the best for them to use depending on diameter or activity. With prosthodontics, Straumann also allows for Straumann Blueprint that allows for quicker digital dental flow and improved communication between specialists, labs, and general dentists that are all helping in this patient's treatment. And also Straumann scan bodies help proper restoration positioning in the mouth. So all these factors are important to know and to follow so that we can meet those goals that Straumann puts out for that 98% survival rate that we've mentioned, and for proper maintenance of the area.
Overall, we do recommend the Straumann Rock Solid implants for use in dental practice. They have a better strength than most dental implants on the market due to the zirconia mixed with the titanium. They have a very good biocompatibility due to the SLA active coat that increases hydrophilicity. It has great osseointegration. It's less invasive with a shorter healing time and a higher survival rate. We hope you enjoyed our presentation on Straumann Rock Solid implants. Here are references we used. If you have any questions, please drop them in the comments.